You should do it, Mike.
And we're live.
Hey guys, say it once you're on the count of three. Ready? 1, 2, 3. Hey
Hey,
guys, we're here at RevePeel night. Everyone clap. RevePeel night. It's like a studio. This is amazing. So I'm very happy to have one of my ginger clients here tonight. And the reason I bring that up, and I say this on purpose, is with lighter hair, you're more sensitive in the sun, which means at an earlier age you can get skin cancer. And this is the thing you guys need to know. These peels and lasers like Fraxel and Halo actually decrease the chance of you getting skin cancer. And peels like this that have TCA and phenol mixed with the salicylic acid to get more of a penetration of the skin can help prevent the formation of skin cancer. So my clients like this with very sensitive light skin and hair need to be doing these peels more regularly. Now, I always smell. Woo. And I go like that because it's like I'm back in med school in the first year walking into cadaver lab. Because phenol smells like cadavers, you guys. But then we know it's working. So the entire room is gonna smell like that, but you know it's working, which I love. But the other cool thing about this RevePeel, and we're gonna start out first, we're just gonna do one little pass on his forehead. We're gonna rub it in, and we're gonna see when he starts to feel some warmth. We're gonna do a little bit here. The good thing about this peel is it's an oil-based peel. And so the penetration is much more even and balanced throughout the application process. So we just did an initial pass. We're just gonna kind of watch the skin a little bit. And the combination of salicylic, lactic, TCA, and phenol help give a mixed acid combination improvement. How's it feeling?
It's feeling good.
You feeling any warmth yet?
Yeah, it's a little tingle.
A little tingle? Okay.
It's like a dentist.
Smells like the dentist. I thought it smelled like cadaver.
We just compounded this batch this morning.
So this should be really strong. So we're gonna give it a minute. We're gonna talk about the peel. The peel is a combination acid. This is one of those where about 3 to 7 days you can get some light peeling, usually about 2 to 4 days on average. And you can sometimes get frosting and sometimes not. We're gonna do a second pass. Again, that thin film. Now, I did my fellowship, you guys, in San Francisco, where we did tons of peels, okay? And in San Francisco, when we did this, we used to take all components of this and mix them together, and we'd make something very similar. However, when they're mixed together at the right equal smaller components, can you get a little gauze for his eye? Because he's starting to feel it a little bit. How's it feel? Dad is right. I watched the skin and throw that away. Good. Just don't want to touch anything in his skin. So we're waiting to see the response. So now we're noticing a little bit of redness. Okay.
What Fitzpatrick's are best for this peel?
So this peel can be used almost on every skin type, but I would say the best, I want to show you guys, look right here. And those little acne, he's starting to get a little frosting. The best Fitzpatrick's are 1 to 3. Okay, so now we're gonna go to the next pass. He's gonna start to feel it now. Okay, I've been doing peels for a long time. All right, so we're gonna rub these in nice and even and firm. Outer in is the typical technique. Right now we're going out, in or out, because we've already done our initial passes. We're rubbing. We want to rub and scrub. Okay, this is not a spackle. This is a scrub. When we do this type of peel, we want to go like this and clean the pores. This is cleaning the pores. Okay, so now we're looking. Look, now we're starting to get some of that oil dissolved. Was anyone asking anything? Not yet.
Your work is beautiful.
Oh, love these guys. All right, how is it feeling now on a 1 to 10?
It's getting there.
He's starting to feel while he peels. Okay.
Is there a RevePeel Black?
So is there a RevePeel Black, or is this RevePeel Black?
This is not a RevePeel Black.
Rev Black doesn't exist anymore.
Only for you.
Only for me. So we're gonna do that in his second peel. I want him to feel. Now look, you guys, look at his cheeks, okay? Look what we're starting to get. Turn a little bit. This is type 1 frost. You could see that speckled frost upon a background of white. All right, turn a little bit more. Look also here on his forehead. Look at that speckled frost on a background of red. So we want to go a little bit deeper. Turn a little bit. Let's give it a minute. Give it a second. We're going to scrub. Do a little more of a scrub.
Black is just to have a higher concentration of phenol than this one.
Right.
But today this peel is with just a fresh compounded this morning.
Oh,
So
that
it's
means it's
very-
like going getting that, picking up that fish and eating the sashimi that night.
Yeah, exactly.
It's
So
ready. It's perfect.
So it's very, very strong.
It's very
already.
strong.
Yeah.
Now look, you guys can see we're blending now. He's getting a really good response. It's gonna be a nice peel, nice even frost. Okay, we're bringing a little bit.
Wow, this is frosting. Okay.
Look at this beauty. Okay, wait, all the thing I want you guys to notice too is all of this could be even precancerous skin cells. And we're getting rid of those. So in case there's any issues here underlying, if he did this consistently every quarter, we would have the risk, we would mitigate the risk. And what's one thing you guys can do? Let me poll the audience. What's one thing you should do on a skin type like him to further prevent him from getting skin cancer? Anyone know? No? Anyone? Anyone? What? Besides the laser, what else could I do right now with the peel? I could apply it to his ears. Why would I do that? Turn. Because the ears also get some sun damage.
Everyone said SPF.
So they said SPF,
Everyone
yeah.
said
So we
yeah.
want to ear it up. Want to ear it, but then in about 2 weeks, what should we do, Justin?
A laser.
Fraxel. Good. So
So
we're just
we'll
gonna
do
do
the
a
whole-
little bit on his ear
we'll
because
do
that
the
will
whole-
get us some preventative for
What about the
him.
neck?
Oh, this is perfect.
Can you discuss if this peel is indicated for acne or hyperpigmentation?
So let's talk about that. So in lighter skin tones that have hyperpigmentation, the RevePeel will actually work very well. And those with darker skin tones, we wouldn't want to do an inflammatory peel like this. We would want to do an enlightened peel. So in our lighter tones, it's fine. In our darker tones, no. Turn a little bit this way. It will treat acne because of the salicylic acid. Look at the nice frost. Let's get it even. Okay, we want to get it nice and even. We're scrubbing, scrubbing.
What about the neck?
You can treat the neck. You can treat the neck with this too, because it's an oil base, and even TCA, regular TCA, you can treat the neck as well. But I would be more careful with it. It's not as control. All right, we're doing the folds. You could do his lips if you wanted. I'm scrubbing. We want to get a little bit more even through here. We're pretty close to done. I notice that the nose, it's a little bit harder for the nose to get frost. Why? Because there's a lot of oil production from the clogged pores. But that's why we do a facial. Okay. We're evening it out. Look at that. Look how even that is. Look at that nice frost. This is perfect, you guys. This is the medium, superficial to medium depth peel. If you really wanted to be a little more aggressive, we could do about a half more of the Rev. We'd do another half and add it if we want it. I'm not gonna do it because he needs that. He wants only that specific downtime.
Yeah, I think this is good enough.
But I love it. I think it's gonna be fantastic. What else is our audience asking?
How many passes?
So it's not about passes, guys. It's about results. So we're looking at the result. And you see that even frost, the nice smoothness and look in the skin, and that's it. And that's how we do it. But one
Yes,
cup
still
equates to what? Full face.
Yeah, full face, 5 ml.
5 ml full face. It's perfect.
Yeah.
So let's talk to our patient. How do you feel?
Feeling good.
On a 1 to 10, what is it? What is the Rev pain?
Let's see. Solid 4 to 5.
Okay, usually it's 4 to 5. That's normal.
Yeah.
That's pretty normal. You're a tough guy. So yeah, I mean, he's doing great. I'm just trying to even everything out.
How is it different from Enlighten?
Enlighten, remember, is an exfoliating and lightening peel. That's not a burning peel. That's a peel that exfoliates over time. And take a look. Let's do a final up close. Look at that beauty. Look at that beautiful, nice. Even a little bit on his ears. We did some coverage here. Very little to start because I don't want him to get too nervous. Once we do the next peel, we'll go and do a little more aggressive on his nose, on his ears. Actually, we can maybe, do you have another one there? No?
Yeah.
Can you grab me one more Rev?
One more red.
I'm gonna do a little on his
I
ears.
want you to say, hey guys.
Hey guys. And you have to
Hey,
do like
guys.
this. Hey guys. To go into the camera. I don't know how that occurred, but it just started. I'm gonna show you guys ear peel. I think it would be great to do.
This is fresh. I need a Rev.
Just regular Rev, not fresh. All right, I'm gonna show you guys ear peel. I wanna get his ears to be as frosty as here. So let's prep. Do you have alcohol? Just give me a little alcohol.
For rosacea?
No, so interestingly, you guys, salicylic acid helps rosacea, but TCA typically doesn't. But because this is an oil base, so pour that into the other. So turn your head a little bit. I'm gonna wipe off his ear for a second. Turn to the other side. I'm gonna do his ear and nose. Hi guys.
Say hi, Dr. Emma.
Hi. So, okay, this is what we're gonna do. So let me switch up. Give me. Yeah. Which one do you recommend? This one? Yeah. So we'll finish it up. Let me just finish the peel with a little bit extra.
Dr. Gloria is the one we met in Vegas.
Love her.
I want her to take our Emerage.
She will. Okay, so here's a couple things I wanted to show you guys. So I'm gonna use a little extra because I want some of this upper portion to be a little more blended here. I also want his nose to be a little bit more. Okay, turn left for me. And now all the way, all the way, all the way. We're gonna go to the edge over here. And we're gonna do a little on his ear, okay? The ear skin is very similar to the cheek skin. Although there's cartilage underneath, the skin here is actually relatively thick. So you may need a little bit more than you'd think. But he does have some sun damage. That's why I didn't want to say no to doing this. So let me let that sit a second, turn to the right. All the way, all the way, all the way. Good. And in an oil base, it's a lot easier to get it to stick. And again, I'm just going to do a little bit more on these areas.
Love this life. We need to do more often.
I agree. Go to emeragecosmetics.com to learn more. Visit RevePeel's Instagram. Okay, now turn again. We're gonna let that sit a second. Because as you see with these peels, you have to have one major component, patience. Gotta let it sit a second. Is the rest of the face starting to go down and burning? Or is it where I'm applying more painful?
That's all even right now.
Okay. Got the peel, we got the fan going. He's gonna look so good in a week, you guys.
Any products you would recommend after the peel?
Yeah, we actually, there's a lot of recommendations we have, even using retinol. Turn a little bit. Good. So now look, if you guys see, if you look at his nose, look how much more the peel is taken now. Okay, turn to the right. Let's go back to the ear. Some of his skin's a little stubborn, so we gotta get it. So he'll be a little red after the peel. Now the frost, you guys, is denatured proteins. That frost will disappear in an hour or two, and he'll just look red. And then what'll happen is that denatured proteins will turn into dead skin that will peel. There we go. Starting to get some frosting now. Perfect.
We have a lot of esthetician in East Coast. It's already very late. They still stay late watching it.
We love that.
Yeah.
Make sure you guys write on my Instagram and you tag us so we can repost you.
So it's safe for skin types 1, 2, and 3.
Yeah, mainly 1, 2, and 3. Turn to the left a little bit more. Now we're very even, you guys can see. And look at his ear, turn to the left. We're starting to get a little bit of peeling, so last pass or two for the frosting. Again, we want that nice, even frost. Now,
So watch you from bed.
Major areas. Where do you think the most common area of skin cancer is on the ear? Here, top, middle, or lower? Yeah, we hit the sun up here, guys. So we got to make sure this part gets a nice frosting. All right, he's basically there. Nose looks perfect. Love it. I'm very happy. A little more on the beard, just slightly. Let's get a little more on this forehead area.
Next time
Turn
we
right.
go to New York, we do it online.
Oh, we will.
Then we will be on the East Coast time.
Turn to the right again. Perfect. All right, one last pass and I'll let you guys go. I want you to just take a look at that nice frosting he's got. It's really coming in. I'm going into the corner of his nose, trying to get it to spread down a little bit more, bringing it up a little bit higher. Okay, so that's it, you guys, and we will have him do a little testimonial every couple days so we can see how he's looking, and then in a week he's gonna look like a baby. All that sun damage will be gone, and he's gonna have perfect Rev skin.
Perfect. Dream skin.
Right? Perfect Rev skin.
Dream skin, right? Dream skin.
Dream skin.
All right,
Yeah,
so how are you
yeah, the
feeling?
rabbit,
How are you
you feel-
feeling? Tell everyone.
It's feeling good. It feels tight already.
Yes, that's
Yeah.
good. That's what we
Very
want.
tight, right?
So inflammatory peels will feel that way because they're denaturing. Remember, these proteins are dying, and the skin is going to heal from within. Bye, guys.
Bye.
All right, turn a little to the right. You just finish your ear. Keep going.